Hi everyone, I'm Dr. Brayer from Creating Smiles Dental, and today I wanted to talk to you about the difference between a regular cleaning, known as a prophy, versus a deep cleaning, known as a scaling and root planing. So over the years, we've had many patients ask us about this difference because they weren't really sure what a deep cleaning was. So basically, you know that when you eat, you get, a lot of food particles that get stuck on your teeth, and that becomes what's called like a plaque or plaque buildup. And the bacteria that lives inside of that plaque, over time, it can cause periodontal disease and it can cause cavities. So that's why you really want to make sure that you're brushing and flossing regularly, and then coming to your dentist and getting regular cleanings and checkups to ensure that you're having healthy teeth and gums. So your gums normally, the healthy gums have about 1 to 3 millimeters of pocketing, and the tissues are very firm and pink, and they don't really bleed. And when you're brushing and flossing, they feel firm and they don't hurt. When you start getting the tissues, they start getting more of a deeper pocketing, or they start feeling like looser and they start bleeding more, then that's when you start getting periodontal disease, which is bone loss, and the teeth start getting very inflamed and everything. So that's when your pockets, instead of being 1 to 3 millimeters, there will be areas that are like 4 or 5, or even greater. And the higher the number, the worse it is. So that's where we diagnose a deeper cleaning, and that's if you have the bone loss associated with the deeper pocketing. So now I have an app that I'm going to show you that I show a lot of our patients when they ask that question, why do I need a deep cleaning? Okay, so this is it here, and you can see this shows a tooth with like normal bone, and the pink is the gums, and that is actually the ruler that I use to measure the pocketing. And the black strip there, that's about 3 millimeters, and the white strip goes up to 6 millimeters, and then the other black goes up to 9 millimeters, and it goes up further like that. Okay, and that's like our tooth ruler. So that's 4 millimeters, and then it goes up to 5 millimeters, 6 millimeters, 7, 8, 9 millimeters, and it just keeps progressing. As you get more bone loss, you see the gums get very red and bleeding, and then you see the tartar buildup in here. So if I pull back, you'll see there's tartar buildup that starts forming. All that brown that you're seeing as the pocketing gets deeper, you get more tartar buildup and you get the bone loss. Okay, so that's periodontal disease. And the longer that you delay with the deep cleaning, it just gets more and more buildup, more inflammation of the gums, and you just keep losing more bone. Okay, so now you ask, what can we do? What we do is we do a non-surgical procedure called a scaling and root planing, where you have all this buildup, and what we do is we go in with our hand tools, our hand scalers, and the ultrasonic machine, and we literally clean it out. So you can see, I'm going to replay it one more time. You can see it just literally gets scraped out. It's not as fast as this. It usually takes definitely longer than a regular cleaning because we go into every nook and cranny, but that's how we clean it. And so then after that, then the gums will be able to heal and they shrink back down again, and that's how the pocketing, instead of being up there, then the pocketing goes down. You don't regrow your bone though. Once you lose the bone, then it's gone for good. Okay, but your pockets will be healthier, and after that we come back and we check you in 6 weeks. We see how you're healing, and then we go from there. And usually after that deep cleaning, we do what's called a periodontal maintenance cleaning, which is normally every 3 months, or it could be a little bit longer depending on how well you're cleaning. Like if you're doing a great job with brushing and flossing, and you're keeping it really clean, then we may bump you back up to 4 months or 6 months, of maintenance cleaning. Okay, so I hope that helped a little bit, and if you have any further, questions or concerns, please feel free to give us a call. Thank you so much. All right, have a great day.